You're like here. I need a little fan. Oh, me. Like, yeah, I'll pop them down as soon as we get to take the pic.
And make sure not upside down.
Go back, shit.
Alright, and you guys know the lineup. Ashlyn's gonna do the introductions, then it's Kirsten, Kelly, Jesse, Aaron.
Great.
Okay.
As soon as that's done, alright.
Enjoy that.
I think you guys all stay there because it's almost 11, so.
Yeah, sounds good.
Let's rock and roll.
Take the roof off.
I can hold up maybe there. Keep your signs and everybody stay up there.
Can I take a picture of you as well?
Give your baby a mat. We're gonna
Because this
keep
is a really
everybody
good
up there the whole
perspective.
time. Gotcha. Stay up here. Beanie outside just catching the exercise.
Yeah.
Digit Betty.
Ashlyn, you know you're leading, you're starting, right? Yeah. As soon as Meg's in, you can go on the start.
Okay. Can we
Where I go? I'm just gonna scooch in a little.
Yeah. Should be like right here.
No way.
No, yeah, no.
Hey, Ashlyn,
No, because I'm missing
kick it
enough
off.
of that.
All right, everybody quiet.
Nurses at Maine Medical Center and Eastern Maine Medical Center are currently in contract negotiations. We are here today to call on management to address our concerns on workplace violence and safe patient staffing in a real, concrete way. Our proposals are data-driven, fact-based, and essential for patient care. I would like to introduce Kirsten Lane.
Good morning. My name is Kirsten Lane, and I'm a registered nurse in the emergency department at Maine Medical Center. I'm also a union member of the Maine State Nurses Association and a member of the bargaining team at Maine Med. We are currently negotiating a new contract with Maine Med. One of the most important issues voiced by our members in the hospital is to win contract language that protects nurses from workplace violence. I don't know a single nurse who has not experienced some form of violence, ranging from verbal threats to physical attacks. My coworkers have been punched in the face, one had their nose broken. I personally have been hit, kicked, spit at, verbally threatened. I know the panic that grips you when you're in an aggressive situation. Others have been thrown to the ground and choked, as well as having themselves and their families threatened. It is horrific, but sadly not surprising. During the past 10 years I've worked at Maine Medical Center, I have seen our patient population grow exponentially and come to the hospital much, much sicker. Patients who come to the hospital sicker are much more vulnerable to behavioral issues, whether it be from dementia or delirium or a mental health crisis. These patients are at a much bigger risk of becoming violent. A huge way that we can prevent these escalations is to be able to provide focused, hands-on, and empathetic care. Nurses have the skill set for this, but we lack the time and the resources to meet even basic needs, let alone focused care. In the hospital, we are consistently asked to do more with less. Less nursing staff, less support staff, less supplies, less resources, less equipment. When nurses are stretched too thin, patient and staff safety suffers. Short staffing creates delays in care and can escalate stressful situations, which can lead to agitation, anger, and confusion. And this makes the risk of violent incidents increase dramatically. Nurses know that chronic understaffing in hospitals is a primary driver of violence. When we are short-staffed and caring for too many patients at once, we cannot dedicate the time needed to recognize the warning signs of agitation and to de-escalate a situation before it turns violent. Maine Med can and should do better in protecting nurses and patients. We are proposing very common sense solutions to what we face daily. First, we're proposing metal detectors at all our public entrances to keep weapons out of the hospital. Second, we're asking for dedicated psych nurses in the emergency department so they can bring their expertise in helping to de-escalate situations. Third, we're asking for crisis intervention training for all nurses. Fourth, we're asking for trauma response specialists to help debrief nurses after violence occurs. These are not groundbreaking ideas. They are tried and proven measures that work and help reduce workplace violence. It's time for Maine Med to stop denying nurses a safe work environment with the excuse that our demands are cost prohibitive. That feels like the biggest insult of all, that our lives are not worth the cost. Let's stop this now and start prioritizing nurses and patients over profits. Thank you.
Thank you, Kirsten. Next is Kelly Brennan.
Good morning. My name is Kelly Brennan, and I am a registered nurse in the neurotrauma unit at Maine Medical Center. I am a very proud union member of the Maine State Nurses Association, as well as a member of the current bargaining team down in Portland. I'm here today to tell you a little story and provide a little context for why we're here. You see, 3 years ago, when we were negotiating our first union contract, we proposed safe nurse-to-patient ratios. Maine Medical Center would not even discuss the proposal. They had zero interest. But as nurses, we know our patients can and should have the best care possible, and we will not be deterred. So the following year, we introduced a safe staffing bill in the Maine legislature that would have required minimum mandatory nurse-to-patient ratios. Decades worth of research show that reasonable and forcible nurse-to-patient ratios improve patient outcomes and decrease injuries for both patients and nurses. However, the senior management of Maine Med, along with the entire Maine Hospital Association, made a full court press to lobby against our bill and against our patients, which would have made safe staffing the law of the land in the entire state of Maine. Imagine being so opposed to the one strategy that has proven time and time again to significantly improve patient outcomes and decrease harm to patients and staff, just to protect your bottom line. I can't, can you? Well, management at that time changed their tune, and they told the legislature that that subject belongs at the bargaining table and not at the State House. Well, guess what? We heard you loud and clear, and we are back. We will be presenting our safe staffing ratio proposals at the bargaining table this week. And I promise you, we are fighting for something much bigger than pay raises and healthcare, as important as those things are. And believe this, from Portland to Augusta and Bangor and beyond, we are united in this fight, and we will not give up until we win. Thank you.
Thank you, Kelly. Next is Jessie Lambert.
Hello, friends, colleagues, and fellow advocates. My name is Jessie Lambert, and I'm a registered nurse at Lafayette Family Cancer Institute within Northern Light. I want you to close your eyes for a moment. Picture a loved one, a parent, a spouse, a child, in a hospital bed. Now imagine their nurse. They are calm and attentive at your loved one's bedside with time to answer questions, provide education, and deliver the high-quality care that every person deserves. This is not a luxury. It should be the standard of care in every hospital across this nation. This is the care our community and patients deserve. The reality is, nurses are rushing from one room to the next, frantically juggling care for too many patients. This is why we're here today to talk about nurse-to-patient ratios. This is an issue with direct life and death consequences, not just for our patients and the communities we serve, but for the nurses like us who dedicate our lives to caring for them. For far too long, the nursing profession has been stretched to its breaking point. Driven by cost-cutting measures, Hospitals undercut acuity systems, increasing the patient load for nurses. This is not simply naive oversight, it is a fundamental flaw in our healthcare system that puts profit ahead of patient safety. When nurses are overworked, understaffed, and overwhelmed, the quality of patient care suffers. Research has repeatedly shown a direct link between high patient loads and negative outcomes. Having too many patients may result in higher incidence of medication errors, more hospital-acquired infections, higher risk of patient falls, increase in assaults on nurses, and tragically, a higher patient mortality rate. The solution is clear and evidence-based: mandatory, safe nurse-to-patient ratios. We have a roadmap. California, the only state with mandated ratios, has seen the positive results firsthand, including improved patient outcomes and increased nurse retention. By putting enforceable standards in place, we can ensure that every nurse has a manageable workload and every patient receives the care they need. Ratios are a starting point, the minimum. EMMC nurses in our communities are also struggling to access the health care they need. Service lines are being terminated without consideration for the patients dependent on them. Northern Light closed our pain clinic last spring and then closed the walk-in clinic in September. They also reduced appointment availability for imaging services, creating further unnecessary delays for biopsies and MRIs. Our communities are hurting. That's why we're speaking out today.
Thank you, Jesse. Next is Erin Oberson.
Good morning. My name is Erin Oberson. I am a nurse at Eastern Maine Medical Center. As nurses, our first and most fundamental duty is to do no harm. We are the constant presence at the patient's bedside, the watchful eyes that constantly assess for subtle changes, and the compassionate hands providing care. We are the guardians of patient safety, and our role is both a profound privilege and a heavy responsibility. Yet we know another reality. Each day, we face systemic challenges like staffing shortages, high workloads, and a broken healthcare system. And by saying healthcare system, I'm really lying a little bit. We don't have a healthcare system in this country. We have a for-profit disease management system. And we've all seen the healthcare capitalism on display in our communities with the recent Anthem and Northern Light negotiations. Let me tell you how nurses see this. We do not treat patients based on their insurance coverage or ability to pay. Nurses are, first and foremost, humanitarians. We don't care how you got here or what tax bracket you're in. All we care about is helping you heal and getting you back to your family and your life. Nurses care about putting patients over profits. The time has come for our hospitals to implement safe patient ratios so nurses can care for our patients as we were trained to do and ensure the best outcomes possible. Thank you.
So we'll just do a quick chant. Let's do When We Fight, We'll Win. And we don't have to do it for 20 seconds.
Oh, thank God. Sure.
Just let's do a round of 3.
Okay.
Okay. All right.
Jesse, you want to lead it off?
Sure. You did good. Yeah.
When we fight,
We win!
when we fight,
We win!